Okay, I think we have enough people so we can kickstart with the webinar. Thank you all for joining this SGP VII special webinar. And this will be our program outline. We will have our executive director welcome us and give us an overview of co-NTD, ARNTD partnership, followed by two speakers, Leslie and Benjamin, then a question and answer session for 20 minutes. Before I introduce our speaker, I would like to give these few housekeeping rules. One, the webinar is being recorded and will be shared on ARNTD website. This webinar is also being translated to French and Portuguese. You can click on the interpretation function to choose the language of your choice. Due to the number of participants, the video and microphone have been disabled. And please use the chat function to also introduce yourself or report any technical issues. You can also use the Q&A to post your questions and comments. Now, I would like to introduce our chairperson of Dr. John Amoesi to welcome us and give us an overview of ARNTD co-NTD partnership. He is a man with many hats, but with time, because of time, I would like to mention just few of them. He is the executive director for ARNTD. He is the senior lecturer at the School of Medicine and Dentistry. He is the research group leader, PI, for the Global Health and Infectious Disease Research Group at KCCR. He is also adjunct assistant prof at the University of Minnesota. Dr. John Amoesi, please, you have the floor. Thank you.
Thank you very much, Hazel, and good morning and welcome to everyone. Can you kindly confirm that you can see and can hear me? Because on my screen, I still see Hazel's screen.
Yes, please, I can hear you.
All right. So thank you very much for the opportunity, and I wish to welcome everyone to this special webinar that we are carrying out. The objective of this webinar is to specifically target countries, particularly researchers from countries which we have not received any applications from for the Small Grants Program. We'll be diving deep into what the Small Grants Program is about, and I will be handing over to Ben and Leslie to do this. But in just a minute or two, I just want to point out that the ARNTD has been working for the past 7 years very closely with the Coalition for Operational Research on NTDs to run the Small Grants Program. The ARNTD in itself has been a network that's been around for 10 years. We'll be celebrating formally our 10th anniversary next year at the International Conference for NTDs in Africa, which we held from the 20th to the 22nd of January in Kigali, Rwanda in 2025. And the network has a focus on really promoting African-led NTD research, which spans basic research through to social science or field epidemiologic studies, really spanning the entire gamut of research on NTDs. That being said, our Small Grants Program has focused heavily on operational research for the preventive chemotherapy NTDs, and more recently, we're also including skin NTDs. The Small Grants Program has been funded primarily by the USAID, and also prior help or sponsorship support has come from the UK Foreign Commonwealth and Development Office, the FCDO, as well DFID. So the objective really is to provide a unique opportunity to NTD researchers across the continent. A focus is largely on young NTD scientists, researchers, but there's also the opportunity for mid-career scientists to also benefit from this, and you would hear more of this as we move forward. I must also emphasize that we do engage the more senior researchers within the capacity of being collaborators or reviewers, or just providing that backstopping that is often needed for the success of any research, especially when the lead researcher is new. So with that, I would like to say thank you very much. We're excited to have you all. I see we have about 38 attendees from various countries. I'd like to kindly ask if you can, within the chat box, kindly type your name and the country from which you are coming. We know you registered for this, but so we have this information in the background, but it'd be nice for others also to know where you are joining us from. So just a short introduction, you can type into the chat. It'll be very much appreciated. Hazel, I'll hand over back to you so that Ben and Leslie can give a more detailed overview of the Small Grants Program. Thank you very much.
Thank you, Dr. John Amwesi. We'll hand over to Benjamin Chiabu. He will give us SGP initiative from impact to expanding reach. Ben, please, you have the floor. Thank you.
Thank you, Dr. Hazel, and thank you, Dr. Amwesi, for the introduction to this particular webinar. As Dr. Amwesi has rightly put it, the ARNTD has been around for almost 10 years. And as a collaborative of community of African researchers, policymakers, implementers, and also clinicians, the ARNTD has, in effect, a flagship program in the form of the Small Grants Program. The Small Grants Program falls within the entire framework of ensuring that the ARNTD promotes NTD research to create and sustain the next generation of NTD researchers for and by Africans. And by this extension, the Small Grants Program has as an objective to realize this particular goal of promoting NTD research and to create that sustainable framework for the next generation of researchers by ensuring that we support African leadership, involvement, and their visibility in NTD operational and implementation research in and across Africa as one of the major objectives for the ARNTD Small Grants Program. In doing so, we also wish as an objective to contribute to improving research capacity as through this Small Grants Program for researchers who may be working in academic institutions, programs, and in other areas that will facilitate and move forward the agenda of promoting NTD research and translating this research to be able to inform policy and discussions and implementations across the board. In doing so as well, the ARNTD Small Grants Program has an objective to be able to create the opportunity, as you heard from the Executive Director, most especially for young and upcoming researchers so they can gain experience in research, grant applications, management, and program management that is aligned to research to be able to effectively carry on the many tasks that may come along with research with NTD. In doing so as well, as we seek to be able to enhance this particular collaborative between African research and policymakers, we also do reckon that there is a need for us to improve the kind of South-South communication and collaboration among researchers, such that we can have researchers within the African sub-region communicating and collaborating and working together to be able to implement NTD-related programs. And in doing so as well, by extension, be able to encourage some kind of a North-South collaboration, as we do agree and believe that this particular enterprise, in terms of the Small Grants Program, provides and will provide for applicants and all participants the opportunity to have this kind of collaboration among themselves and among ourselves within the African sub-region, whilst also opening doors for us to be able to have that kind of collaboration with also partners outside of Africa. As said, the Small Grants Program has been around for a while. This is the 7th round for which we are rolling out, and this has happened since 2017. In this particular slide, you would see that we have several countries ranging from Nigeria, Ethiopia, Ghana, Tanzania, up to Guinea that have by far put in several applications. We have over the years have received some 1,734 applications from 40 scientists across different countries in Africa, disbursing almost 1.8 million to be able to advance the agenda of the SGP grant. By this, the applications have come from PhD students who are working within the framework and scope of NTDs, research scientists from universities, and also from research institutes, medics, paramedics, faculty members from universities programs, and especially Ministry of Health scientists and policymakers, as we have come to realize that there's expected to be that link between policy actors and also researchers as we move along. In doing this, we have awarded several SGB grants to several participants from many different countries. And you can see that from Zimbabwe to Zambia, Uganda, and Togo, up to Benin, these are the number of awards that we have awarded per country. If you take a look back at the number of countries that have, as a matter of fact, put in applications, and the number of countries that have received awards, we would like to reiterate at this point that it is based on merit, and it is also based on a clear-cut criteria for assessment and award as it is. However, given the history of the SGP for the past years, we have also come to the realization that several other countries have not put in the application. One of which motivation we are having this special webinar to ensure that we expand that reach to be able to get applications and get the participation of countries, especially, which I shall mention them one after the other, who have until now not put in application up to date. We have Algeria, Cabo Verde, Comoros, Djibouti, Equatorial Guinea, Eswatini, formerly Swaziland, Lesotho, Mauritania, Mauritius, Morocco, Niger, Sao Tome and Principe, Seychelles, and Tunisia. It is our fervent hope that we would have applications from these countries to more or less get us that collective and broader scope of reaching every researcher or interested party within Africa, as the ARNTD's main purpose and goal is to be able to have these researchers from Africa working on African problems and creating African solutions to be able to propel the NTD agenda in doing that. That as well, in realizing this particular problem, in expanding the reach of the SGP grant to be able to involve many of these other countries, as we have mentioned in the last slide, we have by far put in some efforts in reaching out to the University of Global Health Equity in Kigali, which houses the Kikundi Partnership. The Kikundi Partnership is also a collaborative of program managers across Africa, and also reached out to the World Health Organization Expanded Program for the Elimination of Neglected Tropical Diseases. These efforts we have made in our bid to be able to leverage their platforms to collaborate and to also expand the reach of reaching these countries that we have not been able to reach up to this far. And as you can witness also on this call, we have also been able to translate this particular webinar into Portuguese and also into French to be able to give and remove that language barrier hitherto that had been only in English language. And by far also giving some kind of extra premium by organizing this second webinar with much focus to reaching these particular countries. And we will continue by the efforts of ourselves in collaboration with our partners to see how best we will be able to enhance this particular coverage and have an application of SGPs that will come across all African countries to be able to facilitate the agenda which we seek to look at. The SGP comes with several benefits. At the beginning, we have made mention that it is our goal to be able to promote NTD research and then create that kind of environment for young researchers and also experienced researchers alike to be able to build and also strengthen their research capacity. And in doing this, we will be able to give researchers that kind of expertise and knowledge to be able to build competencies in developing protocols and also to develop the skills required to implement projects related to NTD in Africa, and then create that kind of South-South collaboration as well as the North-South collaboration as we spoke about to enhance the kind of visibility that we would like to give to our researchers as they move along their career. And also, by virtue of the fact that there will be several convenings in the form of conferences and perhaps symposia that will provide support for research communication, we also, as a matter of fact, as a benefit of the SGP, we will be able to advance and give people the opportunity to link up with several other partners in and across Africa to be able to move on. By far, running the small grants program, we have been able to chalk some tremendous success. We have been able to record, as a matter of evidence, some SGP grantees who have been able to move on to become independent researchers and faculty members. We have fantastic examples of some of these grantees who have gone on ahead to work in set up their own centers at various universities. So in the slide that you see, you can see one of our grantees who have been able to set up his own research team and is now doing well. And the SGP was a propelling stone to be able to facilitate this. In that regard also as well, the impact of the SGP, especially in the results that come as a result of papers from the respective studies, have been able to contribute to policy change in NTD programs at different countries, thereby giving it an impactful change in terms of bridging policy and practice. And for some also as well, it has been a pathway to further degrees and also research growth. In this slide, we show some of the publications from our grantees that have been able to be worked on and has been published in reputable journals, and the evidence from these particular studies being used in the respective countries to be able to effect change and to gather more evidence for impact. So at this stage, I will kindly hand you over to my colleague, Leslie Mauli, who will take us through how to apply for this current SGP, the SGP VII.
Thank you very much, Benjamin, for taking us through the SGP from its inception and the impact that it has made in the career of a lot of research scientists from the continent. And we're looking forward for more impact on careers, and specifically looking at the countries where we have not been receiving much applications from, for which this webinar is being organized. So we want to now look at for SGP VII, this particular SGP, what is in scope, what are the things that are out of scope, and how to apply, and when to apply, and the details specifically for SGP VII. So the duration for SGP VII is 12 months. This is emphasized on the fact that we are operating on an annual calendar, and we expect our awardees to be able to deliver their work within the 12 months. So this is emphasized here. And we are also looking at how research can inform or provide evidence that we can use to inform research or to inform program implementation within our countries. What are the gaps that are existing? What are the evidence that are needed? What information does program managers really need to help in the effective implementation of NTD programs to lead to the ultimate goal of controlling and eliminating NTDs? Now, the primary focus, disease focus for SGP is the 5PC NTDs, which are the lymphatic filariasis, onchocerciasis, cell transmitted helminths, schisto, and trachoma. But specifically for SGP VII, skin NTDs have been included at this forefront. This has been discussions on expanding SGP beyond the 5PC NTDs. So we have been able to include in this edition skin NTDs or the various skin NTDs such as Guri, Ulcer, Yaws, leprosy, and the others are also included in this edition of SGP. We also want to look at research that is looking at providing equitable access to NTD intervention. So what are the limiting factors to some populations not being able to access NTD functions, and how this can work, how we can really circumvent this challenge and ensure that interventions and programs are being distributed equally to ensure we eliminate these diseases. One other interesting area that has been added to SGP VII is the integration of One Health approach. So we want our these or potential applicants to expand their horizon to include One Health approaches into tackling NTDs. As we know, NTDs goes way beyond as a disease of poverty. It also looks at the environment. It looks at transmission between animals, genetic elements also within that. So we are advocating for applicants to expand their scope and include One Health approaches. The other element is also the inclusion of artificial intelligence approaches into combating PC and skin NTDs. We know artificial intelligence has come a long way and has been a strong tool even in medical decisions. So we want to also see how we can include artificial intelligence into solving problems specifically to NTDs and how this can help improve program management. So the focus of eligible proposals, we have three main focus, which are implementation research, operational research, and as well as post-validation and integrated surveillance. So for implementation research, we want to look at how we can improve programs within various countries. So what are the factors that are hindering equitable delivery of NTDs? Are there practical solutions that we have? How have these been tested? What are the possible solutions? How impactful are they? And are there even new ones that we can develop and test within our context to see how effective they are? As well as identify ways in which we can adopt new interventions or even adapt them and even develop new ones. So these are all areas that we want to explore in terms of implementation research to develop strategies and tools to achieve our goals. In operational research, we want to look at how we can actually generate new knowledge. What new information can we generate to inform decisions? How can we identify in terms of programs that are existing? How do we monitor these programs? How can we decide whether we need to continue certain program activities? How do we monitor and provide some surveillance mechanisms on innovation that are already existing? Or how can we even validate new diagnosis and tools within our setting? So this is also another strong area that we are building up in terms of operational research. Now, for the validation, we want to look at how we can really validate and also how we can identify resurgence and then transmission zones. So how can we identify these areas? How can we make sure that disease resurgence are even sustained and remained below elimination threshold? And then the type of surveillance that we do include xeno monitoring and cross-sectional surveys. However, we do not really entail surveys that are looking at stopping MDAs, those ones that are just just assessing and whether we need to stop them or not. But this one, we're actually looking at validation as well as the integrating of surveillance mechanisms into current programs. So these are the three major areas that we are looking at that we expect proposals coming in to focus on. So expanding on what is out of scope, this specifically looking at the financial aspects. So the grants of SGP cannot be used for payment of salaries. We want to ensure that the small grants or the grants that's coming in is actually used for the research and expand the capabilities and the credentials of our awardees and build their skills to be able to conduct much more research and be able to even compete for bigger research. So we want all the money to really go into the conduct of the study itself and not payment of salaries. There are areas where you can offer probably fees to field assistants and small per diems that probably when you go to the field you might need. Those ones could be accepted, but as a payment of salaries are not allowed in this SGP. We do not also allow SGP funds to be used for attending conferences and meetings, for paying for tuition fees or for courses that you want to attend. We want you to use the money really to conduct the research and make the most out of it. Also purchase of restricted commodities such as pharmaceutical products, purchase of contraceptives, pesticides. These are products that are restricted. You cannot use SGP funds to purchase such products. And specifically, we also entreat awardees to collaborate with their NTD program office so that you'll be able to get some of these pharmaceuticals products from them in terms of if there are certain products that they want to use. Collaborating with your NTD programs will be able to help you to be able to have your work done. And this is a strong angle that SGP look at, collaboration with your local NTD program office to ensure that the work that you do is actually leading or could be used as an evidence to improve program decisions in your country. We also do not support existing programmatic monitoring and evaluation mechanisms. So programs or work that are looking at monitoring existing program activities that the countries are doing. SGPs are really out of scope. We also limited to mapping or mass drug administration transmission assessment surveys like CATOCAS, impact assessment surveys and evaluations. These elements are not within the scope, as well as also conducting such as MDA impact surveys or coverage surveys or knowledge assessments, knowledge attitude and perception assessment surveys. These are research that are not out of scope of SGP. So kindly take note of these elements when you are putting your proposals together. So generally, as mentioned, this current SGP has two scopes. We have the small, the early career grants and then the mid-career grants. So in this edition, the mid-career grants is being restricted to past SGP awardees. So they can apply for the mid-career grant, which is a maximum of 70,000 cedis, $70,000 US. But for subsequent editions of the SGP, we hope to expand the mid-career session to all applicants. For the early career grants, which is a maximum of $30,000 US, this is open to all applications, all applicants from all countries, where in this particular special webinar, we are encouraging applicants from countries that have been less represented on SGP applications to submit applications for this. So when you want to apply for the SGP, when you visit the ARNTD website, the arnt.org, and then visit the grant and funding page, you have the small grants request for applications page. You have the details of the mid-career and then the early career, and then the objectives of the grant as already enumerated and presented by Benjamin. So we have the course also translated into the 3 languages as part of our efforts to expand our reach to less represented countries. So we have the call in English, we have the call in French, and then we have the call in Portuguese. These are identified to make it easy for applicants to be able to understand the call and also submit the application. Now, the submission of the applications, we also allow submission in French and in Portuguese as well, as the initial submission case. But when you submit, and then you are awarded the grants, subsequent documents will be requested to be submitted in English. But in the initial stages, we allow all the 3 languages to come in to help and ensure that we are inclusive as much as possible on the continent. So when you download the application core, we have detailed out specifically how to apply and provided useful information and useful links. So the application form is provided in a link where you can be able to access where the application is and the details and information that you need to submit, which is done online. We also provide a link for downloading the budget. We have a specific budget template that will require applicants to fill in and submit. This is essential to use the template. So if you use any template that is not provided, this will not be accepted and therefore they will be rejected. So we encourage applicants to pay particular attention and use the provided budget template. Now the budget template is divided into sections. We have those that is looking at the laboratory component. We have those that is looking at flow components. So once applicants look at these 3, if your work does not entail a particular component, you can ignore that section and then fill in the sessions that apply to your work. We have also provided links to reviewer's guide. Also, we have application checklists that we also encourage applicants to look at when they are preparing their applications. And there are also frequently asked questions that we have detailed out. So these are also provided on our website and also on the call that we encourage applicants to take their time to go through these documents and make sure that they submit a very strong application proposals that are worthy of review and potential funding. So in reviewing the applications, we go through mainly 3 stages of review process. So the first stage is a triage from the Secretariat, where we look at all the applications that have come in, just looking at triaging, making sure that applications meet the eligible criteria. So we just look at the disease focus. We look at assessing the work that is being done within the scope of the grants, and also general eligibility criteria, which is outlined in the application call, and whether the budget line items are within the scope of the application. So this is the first stage that we look at. Then we go to a second stage where we actually look at evaluating or reviewing the applications by experts within the field. So we have a review board who will take their time to review each application. Each application is actually reviewed by 3 different independent reviews. So these reviewers are not aware of which application a different person is reviewing. So this is done independently. And the review committee is composed of eminent individuals that are coming from the ARNTD Management Board. We have research groups within the ARNTD, that is a basic research and vaccine study research group. We have the operational research group, and we have the social science and implementation research group, where we have elements, or we have key individuals, experts from these areas to be able to have in-depth reviews of the applications that come in. We also have people from the zoonotic research group, but then after this stage, where we go to the 3rd stage of review, we also include representatives from the Coalition of Operational Research of Neglected Tropical Diseases, the ARNTD, our main partner here. We also have members from them also providing reviews. And we also have representatives from the USAID also supporting the reviews. So this goes through all these 3 stages to ensure that the review is done rigorously, and then everything is based on merits. And the main criteria that, as discussed earlier on, is the excellence and technical merit of the application that come in, the potential impact that is going to make within the applicant's jurisdiction, country, as well as the African continent at wide. the research conduct and management, whether the applicant has the required skills, the required capabilities to conduct the research, and whether the applicant even have support from eminent researchers around to really support in conducting the research, as well as even providing training for early career researchers to support in the conduct of the research. And the last aspect is also ensuring that the budget is appropriate and within scope. So as shown, we have scores that all these individual scores come and are aggregated from 5 down to 0. So based on these scores, that is how applications are selected. So this is done independently and collated together to select awardees. So now the SGP process goes through a very intensive review process in selecting awardees. Now, as indicated from the templates that we have, these are some templates that are available for you when you are submitting applications. You can download these templates to be able to go through sample questions and see how the questions are, so that you can even understand what questions are being required from before you start filling in the application online. You also have the prepared document. Once an applicant is selected, a template to be sent for the applicant to really review and provide in-depth proposals. But the initial stages from the online application, we have a very brief one that you submit. Once an applicant is selected, a detailed template to be sent for you to provide a detailed proposal. And you also provide technical support in shaping and making sure that this proposal is written up to standard and will be able to generate the intended results. As emphasized earlier on, the budget template is provided. If you're unable to access, you can still reach out to the secretariat at ARNTD.org, and then we'll still furnish you with the templates. Please make sure that you submit the required templates. If you submit, these are examples of some templates that have been submitted, and these will not be accepted and will therefore be rejected. So we encourage applicants to make sure that you use the right templates when you are submitting your application. So kindly pay attention to these details when you are submitting your applications. So in a nutshell, these are the various information that we want applicants to take particular attention to when you are preparing your templates, and ensure that you submit high quality applications that will be worthy for funding. So thank you very much for your attention. And then we will now switch on over back to Hazel. Thank you.
Yeah, thank you very much, Benjamin and Leslie, for educating us, especially Benjamin, educating on a broad overview of countries that have received the grants, the countries that are yet to receive grants, and the impact of the benefits of SGP. Leslie also giving us the scope, legibility, the budget template, and what is allowed in the budget, what is not allowed, and how the applications are reviewed through a rigorous process. Thank you so much. So we can still post our questions at the Q&A, and we can also raise our hand in the session to be allowed to ask your question, and the speakers will be able to answer you directly. Thank you. So I can go through some of the Q&A and ask the questions and read it out for our speakers to answer for us. Thank you. So one of the questions is it possible to procure training lab supply? So Leslie, can you answer that for us? Thank you.
Thank you very much. Yes, for lab supplies, yes. So that is one thing, an element that we probably could highlight. So applicants have to be affiliated with a research institution or an academic institution, or a health institution with the responsible health authorities within their countries. This is to ensure that the work is being done in these institutions within the countries. So if you are working within, part of SGP is actually to also build the capacity of institutions as well as the individual. So if you, the you might need certain resources that and the SGP you can use the funds of the SGP to procure to help you conduct a particular study that you are about to conduct. This will be permitted. So far as this is also highlighted clearly in your budget line whilst you submit your application. So such institutions or such equipments are permitted. We have some awardees who have been able to purchase specific equipments and that they really needed to support their work, to conduct their work and also build the capacity of their institution. So this element is allowed within the SGP.
Thank you, Leslie, for that. Another question that has been posted: does drug discovery research for specific NTD eligible? Can Louis or Leslie answer that for us? Thank you.
Drug discovery research is not allowed because it focuses on basic science, and this call is targeted at operational and implementation research. And so that will not be in scope for this call. Thank you.
Thank you, Louis, for that. You can still post in your questions at the Q&A. Let me read another question. How many applications can one do? Leslie,
Yes.
can you please answer that for us?
So for applications, an individual can submit only one application at a time. But I mean, different individuals from the same institution can also submit applications. But if for one person or an individual can only submit one application, in case you submit an application and you have an issue with it and you want to probably there's some error on it, you need to alert the ARNTD Secretariat, and then we'll be able to assist you with that. So do not submit duplicate applications, otherwise to be counted twice and rejected. So an individual can submit only one application. I hope that answers is clear.
Oh, I should think so for the question. So you can still go ahead and raise your hand if you want to be allowed to ask a question.
I think somebody has Bratu has a question. Bratu, Tamir, you have been you can unmute and ask a question.
Okay, is it hearable? Thank you very much for your nice presentation regarding this project. What is the question behind me is related to the budget breakdown. Actually, the table of budget breakdown that you described is locally we consider as correct type, but you stated as it is incorrect or wrong way of budget breakdown. So what kind of format does this project that habitually used for? Thank you.
Yes, thank you, Camille. So what we are saying is that we actually have a budget template that we provided a link to. So we are saying that you should use the template that we've provided and not to create your own budget template and submit. So the one that we have when you download it on the application code, there's a link there for you to download, and also on the ARNTD website. It has 3 sections. We have one for sample collection and human field studies. We have a section for vector collection, vector field studies. And then we also have one for lab studies. So we have broken it down to these three sections. So if your research work does not entail lab session, you do not need to fill the lab session. If it does not entail field work session, you do not need to fill up the field, the vector field study component. So we have this template down. We just encourage applicants to use this template when they are submitting.
Thank you very much. I understand it.
Okay, good. Thank you very much.
Okay. See you.
We continue to ask if there's anybody who wants to ask any question, specific question, you can still raise up your hand or post your question at the Q&A section. Let me go ahead and read some of the questions for Leslie or Louis to answer. May I know if there is a limit for the research team we are going to form? As they want to know if there's a limit for the number of research team they can have in a group, either maximum 5 or 10, if you have any limits on that. Thank you.
Okay. Yeah, so for the SGP, the aim is to provide early career researchers the opportunity to really serve as a PI on a research and conduct it. You can definitely get support from senior colleagues who will be to more or less guide you and provide technical support as well as other administrative support in the conduct of your study. So we definitely acknowledge the applicant as a PI, but you can have supporting individuals who support you in the conduct of your study. We do not specifically have a specific limit on that, but we also do not expect you to have a lot of people there. So I mean, you can have up to 5 or 6 individuals who will be supporting you in the conduct of the research. These individuals do not necessarily have to even be named on the general application. So, but when you submit, the SGP will acknowledge the individual who submitted as the grant awardee. I hope that answers this question.
Okay, thank you. I can see Tamar has his hands raised. Can you unmute and ask your question, please? Mibra to Tamir, can you unmute and ask your question, please?
I think
Okay,
Tamir has...
thank you. Is that audible?
Yes, you're audible.
Yes.
Okay, thank you. I'm Jor Salim from Ethiopia. Thank you for the nice presentation, all of you. I have 2 questions. On the application, there is a tip that states not to mention a supervisor more than 3. So my first question is, while we select a supervisor, is that possible to have only 1 supervisor? My first question is that. The second question is, may I know if there is a limit for the research team we are going to form, because this research is done by a team or a group. So is there a limit, number limit, in which we incorporate the individuals involved in our team, or any suggestions you have for the number of individuals to incorporate in our team? So these 2 are my questions. Thank you.
Thank you. Leslie, can you please answer, or
Yes.
Louis, can you answer that?
Okay. Yes. Thank you, Valen. So for the supervisor, for as we are hoping to really build early career researchers, there have been many instances where applicants do not have any experience at all. That is one of the aim of this SGP, that people who do not have any experience in conducting research or applying for grant at all are given the opportunity to be able to learn from this small grant and build up on it. So we actually require you to conduct a senior colleague to at least provide that supervisory assistance where the ARNTD can still contact. This person is more or less giving you, serving a supervisory role to help you in conducting the study, to ensure that the study is conducted through using appropriate scientific methods and rigor, and ensure that you are able to conduct the study and complete it successfully. So that is why we require early career researchers to at least get at least one supervisor to support in the conduct of the study. And as indicated earlier on, you can get a team, a number of individuals to support you. That is the only caveat or point here is that when you're submitting the application, we recognize the applicants as the PI. The applicant is the PI. You can have your team in supporting in the conduct of the research. They do not necessarily have to be listed on the application, but they can provide the support in the conduct of the study. So we will not limit that you can have a specific limit that you can only have 2 people support you to conduct your study. No, you can have a team that's so far as you'll be able to have together. I mean, one of the aim of the SGP is also build capacity within the institution and as well. So if this is also helping in building capacity of other research scientists within your institution, this is definitely welcome by the SGP program. I hope this answers your question, Belly.
Thank you. One wants to ask, how can they confirm the application of the submitted?
Can you come again, Hazel?
The question is, how can I confirm if my application has been submitted? I want to be sure if the application has been received from our end. Thank you.
Yes, so we are using a smart system in submission of applications. So once you submit an application, there should be a message at the end of the submission indicating that your applications have been submitted. If you submit and you get this automated response indicating your application has been successfully submitted, then yes, it has been, unless you didn't get any feedback at all when you submitted the applications. And the application is actually a live online system. So once you start filling in the application, you can even save it and come back later. Once you even save, it's already recorded in the system. So once you submit, you click the submit button and the feedback notice comes on. That is a confirmation that your application has been submitted. Great.
Thank you very much. You can still post in our question. We have a few minutes to get our webinar, get to the end of our webinar.
We have some hands up. So maybe Maria can ask a question.
Okay, Maria, Cecilia, can you please unmute your mic and ask your question, please?
Boa tarde. Boa tarde. Eu sou Cecília da Almeida, Maria Cecília Seda da Almeida. Sou coordenadora de doenças tropicais de Angola. Eu gostaria de saber, porque quando começou o encontro, Angola não foi mencionada na lista dos países. E queria saber qual foi o critério de seleção dos países que foram indicados para esse trabalho de investigação e pesquisa. Muito obrigada.
Right.
You will read the response from your language session. Thank you. Leslie will answer and the response will happen at your language.
Thank you, Maria. So the call is the application is open in different languages and then in different countries. The different countries have been highlighted. If you look at the presentation that Ben made, Angola is actually on the general list. Probably maybe you did not find it on the other emphasis because we are a few numbers there, but these are also part of the countries. It's actually a long list. That is why we're not able to mention each of them individually. But Angola is also one of the priority countries where we are also looking at submissions coming in from that angle. And to highlight the efforts we are making in getting applications from Angola and other countries, other Portuguese-speaking countries, is the fact that we have included an example is the translation services that we are having for this particular webinar, to be able to reach out to researchers and potential applicants from all these countries. So Angola is part of it on our list. Just that maybe we didn't mention it as we couldn't mention all of them on it here.
Okay,
Have,
thank you.
John
I see
here.
Dr. Moisi hands up. Can you please unmute and ask your question? Thank you.
Well, thank you very much. I just wanted to clarify that the countries that were mentioned are not necessarily priority countries, but they are just countries from which we have not received any applications, and we are holding this special webinar as a way of reaching out to researchers in these countries, the ministries, the control programs, so that they can filter this information across. There is no priority given to any country in these applications. The review of the applications is strictly on merit. So there is no advantage to any country. There is also no disadvantage by way of language, which is why we're having this also being translated in French and English and in Portuguese, and the same for the call as well. So there's no special advantage to any country or group of people, and we are trying to ensure that any inadvertent or unintentional disadvantages are removed to the best of our abilities. Thank you very much for that question.
Yeah, thank you very much, Dr. Moisi, for giving the clarification on that. We would like to stick within our time, so we'll invite Dr. Moisi to give us a closer remark, and all Q&A
So thank you very
questions are being answered.
Hazel, for that. We appreciate everyone who's been able to make this webinar. We know the notice was rather short, but we are very glad that you could join. We would kindly request that you, as much as you can, share this information widely with your constituents, with people that you know within your network. Kindly push this information as far as you can to increase the applicants and therefore our pool of qualified applications which will be considered for funding. And I also would like to say a big thank you to the interpretation team from Album for their wonderful work. We appreciate you and I look forward to continue working with you. So with that, I'd like to say thank you very much once again, and we look forward to receiving as many applications as possible from your countries. We're here to support, and we want to have the best research coming for NTDs in Africa. Thank you.